if you tell me what your flaws are, I can tell you that it's a flip side of your strength. The biggest flaw that surgeons have is absolute ownership of patients. We're taught to be the end all, the be all. We fix things, we know all the things. And so then we take responsibility for all of those things. So it's our sense of responsibility, which can then lead to us, leaning into perfectionist thinking and leading into owning things that we don't need to own. I mean, we're not going to not want to be perfectionist.
Yeah.
We're not going to not want to have ownership of patients. We just have to recognize where it's too much.
Hello, everyone. I am super excited to have this lovely human in front of us today. This is Dr. Amy Vertrees. She's a general surgeon, an Army veteran, a certified coach, the founder and host of Business of Surgery series podcast, which is full of all the lessons that we didn't learn in residency, and the author of Become the Boss MD, Success Beyond Residency. And I love in the book, she says it's the guide you didn't know you needed. And I highly recommend that everyone in medicine picks it up because the lessons she shares from her experiences are ones that I completely resonated with. And I wish I had that book years ago. So Amy, thank you so much for joining me today.
Thank you, Jillian. It's such an honor to be here. I've been such a fan of yours. You do such great work and helping to elevate so many people. It's just really an honor that you invited me. Thank you.
Yes. And as I mentioned to you, I wish I had a mentor like yourself when I was going through surgical training and crying a lot and not thinking that I could do it and thinking myself doubt was just me. So those are some things that we'd be talking about today. But for people who haven't met you yet, can you tell them a little bit more about yourself?
Sure. I'll start from the beginning because I think it's helpful. I finished Oh, I did not actually finish high school. I'm technically a high school dropout, if that helps. I left my senior year of high school. So I went from straight from being a junior to going into college. I went to Georgia Tech on early admission and, did really well. And a friend of mine said, you do like C work and get B's. So I think there was an element of me who was smart enough to get by, but I never actually learned how to learn. So I finished my bachelor's degree at Georgia Tech. I was a president of our pre-med society. I wanted to be a doctor. I was really excited about it. But I think there was like this gnawing sense that that one statement that someone said to me created enough doubt in my mind that I was like, maybe I'm not ready for this. And so what I ended up doing was I applied and I didn't get the early admission for medical school. And I just basically I think I just internally panicked. I mean, looking back now, it's all very obvious. It was not obvious at the time. So I went to graduate school and I think that was honestly the best thing that happened to me because I spent 2.5 years at Medical College of Georgia learning cell biology and anatomy. And the ability, everything we were expected to do, I should say, was completely different. I had to teach other people. I had to answer big, long essay questions. We had 12 questions and we would have to pick 9 of them. And it's like 2 hours of just writing. And I really had to learn how to learn. And that was what was missing for me in college. So without that skill of learning how to learn, I don't think that I would be where I am today. So it felt like a bypass. It felt like a cop out. And in the end, after about 2.5 years, I was like, why am I fighting for this when this doesn't fill me with passion? I want practical. And at the time I was doing microsurgery. So I was doing microsurgery on chick embryos, microscope, you have to like make this little metal flint because they're, taking up these little neural crest cells because the person I worked for, she actually discovered that neural crest cells migrated and formed the wall between the aorta and the pulmonary artery. So she's very famous. But I realized like I want more practical stuff, so I wasn't sure exactly what to do then because now I'd kind of like taken myself out of the pool of your normal pre-med thing. So I was like, well, I'll just take some time. And I went down to Florida. I got a job with my biology degree, all I could get, which was basically working at a bank. And I worked as an underwriter for home equity lines of credit, which was really helpful because I started learning like the 8 to 5 job, not for me. Had lots of time on my hands, but it was helpful and useful for me to spend some time in real life. And I think that's really helped me understand that there's more to life than just medicine. I kind of got off the crazy train for a little bit and lived in real life and learned about finances. And I was there actually in a bank that was doing the 125 loans. This was 98, 99 timeframe. So this is like, I got to see the bank's practice that led to the ultimate crash because they were doing these terrible loans. They packaged them together, they'd sell them to somebody else. So it's actually very similar to what it feels like, some of this private equity in medicine, where people do this, they skim off the top, they package it, they sell it to somebody else, they skim off the top. So anyway, so I saw that in motion, but and true to form with what was going on there is that the banks would then close and lay off everybody and then start again. So we were laid off. Then I worked at an OBGYN office, a private practice. So I was the medical assistant. I would basically, write all the prescriptions and I got to see what a private practice was like. So I got to see her manage other people and, I interacted with the staff. I was the one that was always beat up when she was late. I was like, well, she's late. Why are you yelling at me? So I learned how to really interact with other people. And at that time, I started getting back into it. I studied for the MCAT. I started teaching MCAT courses with Kaplan. And then I decided to apply. But I was in Florida at this time, and I didn't know the Florida schools. I met with some of the people there, and I was like, this just doesn't resonate with me. So I picked up this guide that said the best kept secret of medicine and talked about USIS, which is the only military medical school we have. I had never heard of it, but my dad was in the Army, and I was like, this sounds like something interesting. This sounds like, what the hell, let's try it. And I remember going to Bethesda and just be like dazzled by how amazing it was. It's in the DC area. And I thought, this is exactly where I should be. It was just clear as day. Like, this is completely different than anything I've done before. This is it. And it was great because all those things, it was essentially like, I don't know, 4 or 5 year detour, but at the same time, I can see how every single element was absolutely necessary. Oh, I forgot. At the bank, I picked up a husband. We're still married. So
Oh,
see,
nice. Wow. Wow. You said so many great things because there's a lot of times people have this sense of urgency to get into the next step of what their educational experience is going to be like. And oftentimes, right, our brain hasn't completely formed at the ages that we're deciding this. I decided to go into dentistry at 18, and reflecting back, I wish I would have done what you were saying, learned life skills. I think a lot of my failures in the military and also in surgery were because I hadn't leaned into learning life skills, leaning into learning how to overcome adversity. So I appreciate how you're reflecting back and seeing how all these different steps that you took have added to your career. I didn't take away from your experience and actually gave you strengths that you're utilizing today.
absolutely. And, at the time, I knew that there was still some purpose to it. And I knew that I had time, but there's still a lot of discomfort there. There's a lot of judgment, a lot of worry. And, what am I doing? There was a lot of that too. But, once I got into medical school, I was like, okay, it all makes sense now. As I would, every time I go along, even now, reflecting back how important all of that was. And I agree. I think we encourage people to make decisions way young, without a lot of additional information about what life is and what our strengths are and how we fit in the world. And I think something, as you know, in the beginning of the book, I talk a little bit about that, is us being able to stop and reflect and assess ourselves, but also assess the assessment. Because when it comes to it, I think there's so much, as there should be, interest in things like sparketypes and enneagrams and things like that. But if you think about it, these feel true and genuine to us because we're reflecting back our own thoughts. We actually have to choose the paths that we go on. And, I'm an Enneagram 8, which is a surprise to absolutely no one who knows what Enneagrams are. However, it's because that's my self-concept. My self-concept is the go-getter and do the things like that. But I can look back at any other Enneagram and see myself in them too. So, and I challenge my my coaching group. I was like, if you don't like yours, look at some of the others. Pick one of those. Why not?
And it's interesting because what you're saying, we feel this pressure. And I always think about the pressure that we're feeling and the values that we think are ours relating to like being a fish in water and asking the fish, how's the water today? They're like, what the hell is water? Because they've been living in it their whole life, right? It's like until we really step back, maybe go into a country that has different values or being in a situation where having that conflict of values to actually determine what are your values, and to pause, because otherwise we just accept that as truth, right? Both what our values that were provided are and what our thoughts are, which reminds me of the topic that I wanted to make sure we cover today is what is the itty bitty shitty committee?
So it's funny, as we were talking earlier, this concept just kind of came to my mind. We all have this internal dialogue, all these little voices in our head. And I think that there's not really been a big distress to me because I grew up as a reader. Even early on, I would stay alone by myself all the time reading, talking to all these like imaginary people. So the thought of like voices in my head is not that big of a deal.
Mhm.
So, but as we go along, they either become useful or not useful. And I think that's one advantage of reading is that we get to see and experience different characters and different stories without having to do it. And that's what our internal dialogue does is we have all these characters in our head that are talking, and it's based on our experiences and what we know about the world. And they're all having these meetings of saying like what we think about this, what this person, and what we think about this, and what we think about ourselves. And they're making judgments that we then feel like the truth. So then we follow these thoughts without considering that maybe this is just a suggestion based on little neurons firing, forming words, and we're interpreting them like hieroglyphs. So who knows what they actually mean. But to be able to tune into the voices that you have, the ones that say you shouldn't do that, you're not qualified for that, maybe you should try some different things, or I can't believe you made that mistake, shame on you, like you're never going to make it. So those are the voices that we do not consciously tune into, but we certainly react to. So when you start hearing the voices, I forgot which book I just read. He says once you start tuning into them, you realize they never shut up.
Mm-hmm. Yeah.
And so that also leads us astray because we don't question them. And an interesting thing, again, in that book, I wish I could remember, but he said when they looked at people who meditated, like when they looked at the part of the brain, when it comes to, I think that, the verbal part, like the internal dialogue that they think, attributes to, is that people who meditate, it's not like it goes up high or low, it actually goes absent. So like meditation silences those voices altogether, which feels like a little bit like a reset. But anyway, it's a little bit off the topic of what you're saying, but this committee basically gets together and makes decisions on our behalf, sometimes without our knowledge.
It reminded me too of like the very clear moment that I was sitting in oral surgery interviews right next to who would become my program director. And he said to all of us, like, if you're here, you are qualified to be here. Now it's just a determination of fit. And me is like, hell no, I'm not qualified to be here, because I looked at everyone else and they had their first of all, everyone looked very professional, right? We're all in our suits. We've all played the part, but they had their binders that had their schools. And like they went to these Ivy League schools. I went to a very small dental school. We weren't like on the rankings. We didn't have a lot of research funding. And because our society often promotes going to these Ivy League schools and these name brand schools, I made that mean something about my education, even though my dental school we're very well educated and have often very strong skills when it comes to practicing general dentistry, but they didn't love for you to specialize. So I didn't have the support of my school when I went to pursue oral surgery. And then I was offered, oh, are you sure you want to do that? Because I was so sensitive. And in your podcast, you have people that talk about why they went into surgery. And some of it's because they were told that they couldn't. But just like you said about your experience of having that one voice kind of play into your head about why you pause a little bit before continuing to pursue med school, I feel that once we believe something, we validate it over and over again. So if I don't think I deserve to be there, I'm going to look for all of the reasons why that's true. I'm going to look for ways to validate that. And so self-doubt is common, but we can create our self-sabotaging when that self-doubt steers up all these itty bitty shitty committee members and we believe what they're saying, right? And like, oh my God, you're right. I don't deserve to be here. I don't deserve to be here. And one thing I was reading Kristen Neff's Fierce Self-Compassion book, and she says that negative self-talk served a purpose at some point, right? If
Totally.
Yeah, what kind of purpose do you feel that negative self-talk has?
Oh gosh, I mean, this goes into what we think are our flaws, and I absolutely love this kind of work because if you tell me what your flaws are, I can tell you that it's a flip side of your strength. The biggest flaw that surgeons have is absolute ownership of patients. We're taught to be the end all, the be all. We fix things, we know all the things. And so then we take responsibility for all of those things. So it's our sense of responsibility, which can then lead to us, leaning into perfectionist thinking and leading into owning things that we don't need to own. I mean, we forget that the patient comes in there already with a problem. The patient was shot. The patient's gallstone is wedged in a particular way. I mean, they come to us with a problem. We can own the fact that what a surgeon should do, but we cannot own the fact of what's ultimately going to happen to them. So, because they came in with a different problem. So, a lot of the things that we see in ourselves of like we're really hard on ourselves, perfectionist thinking, lack of self compassion because we don't accept some of the things that happen is really a flip side of this absolute ownership that we have. So when you think of all the negative things, all you have to do is say, "Oh, I just overdid it a little bit. Maybe if I just back off, then we'll get back to normal." So there's actually not a problem. It's when we take this over, interpretation of a strength that we have and we put a negative spin on it, is we just step back and say, "Oh, I see where I just overdid a little bit. Let's just, go in this different direction and recognize, of course I want to own this, but what is the part that I actually do own?" And simply just dropping into curiosity and saying, "Why am I reacting to this way? Why does this seem to set off a trigger for me?" And just like you said in Kristen Neff's, no, actually it was the Perfectionist Guide to Losing Control, who
Mm,
said, this is why we can't stop, because we're not going to not want to be perfectionist.
yeah.
We're not going to not want to have ownership of patients. We just have to recognize where it's too much.
Yeah, Kristen Neff actually talks about adaptive perfectionism and maladaptive perfectionism. Like the strive for excellence is great because often people are like, well, I don't want to be a perfectionist. I'm like, well, there's some benefits to striving for excellence. And then at what point does it become maladaptive where it starts to hinder your performance? And I know that you've encountered a lot of perfectionistic thinking and also talked to a lot of people. So can you explain ways where being a perfectionist can actually start to become maladaptive in what circumstances?
Oh yeah, it's actually a really interesting, somewhat actually easy concept if you think about it. So like it was that book Perfectionist Guide to Losing Control. It's We don't want to not be perfect. And so first we can just let go of the desire to want to be perfect. Like I could want to be perfect and be okay with not having a perfect outcome. There's actually a difference. One is my desire is always going to be there. So now I'm not going to try not to want it. I'm just going to decide what that actually looks like. So what does perfectionism look like? And so I could be perfect in the attempt that I had, much like this really great graph that I saw that talks about your best on a day. Well, my best is here today and here today and here today. It's
Mhm.
all over the place. So um, to have a perfect effort is different. Like for me, what was perfect to me in that day was what I was able to do, like the maximum that I could do. And maybe that looks different on different days, but I'm still striving to be perfect, but I'm not tying myself to the outcome that I actually don't have control over. But I do have control over what I could do, and that stems from my desire to be perfect. So in that way, I think perfectionist thinking can be useful. So I'm using this as an ideal to strive for, but I'm not using it as a measurement of what my worth is.
Mhm.
I'm using it as inspiration. I'm not using it as waiting for a judgment about whether I am or not.
That self-worth, that was actually at the core of like why I wanted to become a surgeon. And what I was thinking when when we talk about perfectionism, it can be black and white, all or nothing, good or bad, right? I either did it right or I did it wrong. I am good, I am bad, I am right, I am wrong. And what you just painted was a growth mindset. It was like, I'm going to strive for perfection and learn from what maybe doesn't go as well as I hoped and not
Mhm.
make that mean anything more or less about my worth, and how challenging that can be when potentially if people like me, and what I love about your podcast is that you share a lot of people's reasons for getting into surgery. So if they got into surgery because they wanted to be perceived as a badass know-it-all, and that's compromised because they make a mistake, or you just had a nice episode on complications, and we can have that derail us and make, oh my God, I'm going to quit. I can't do this. It becomes so intolerable. We can be full of guilt and shame. Or as your podcast highlights, how can we really lean into learning from complications and learning from the things that maybe don't go as we perceive that they should have gone?
Yeah, and complications both and our training, which you were mentioning, there's two things that struck me, and they're very similar. And one is like, why are we doing this in the first place? I mean, we're doing this for patients, right? And when it comes to complications, we think that patients expect a perfect outcome, but they actually don't. Like if you were to ask a patient, like, what do you want? Well, I want you to know what you're doing. I want you to have tried your best. And I want you to make sure that you tell me what happens, because a lot of times our patients are asleep. And afterwards, I want you to take me through it. I want to know that you care. I want to know that if something does happen to me, you're going to help take me through that. I mean, they want the relationship that we have to offer. They want our knowledge, which they already is a given. So that's one thing when it comes to complications is, what does the patient want? And if we are too in our head, the very last thing we're going to do is do all the things that they want. We're going to avoid them, may not want to talk to them. So now they don't know what happened to them. And afterwards, we want to avoid them because we're afraid that they're going to be mad at us, or we're afraid of how we feel. So now we're not there for them. We fail the patient when we don't address our own thoughts about the complication. So when you keep the patient in mind, the actions are so much more clear. And that's an easy way to get out of some of our own mental dramas, to ask myself, what's the point of all this anyway? And that goes to our training too. I mean, I'll ask you as you were talking, I was laughing because I'm like, how many patients asked you, where did you go to school?
Yeah, none of them.
Nobody cares.
No, I mean, I went into a new specialty that no one knows what the heck it is, right? It's like,
Yeah.
not even I did, but like when
Well,
I left surgery, but yeah.
yes. And it's funny because, think of all the guilt and the, shame that you had about being in this particular school because someone said you shouldn't or whatever. This is not Ivy League. Well, no one really cares unless we make it something they should care about. So it goes the same thing as like the patients don't care where we went to school. That's not part of our marketing. It's not part of what they're interested in, but they just want to know, are you going to take care of me? And do you know what you're doing? And you can do that a number of different ways. That actually helped me with my kids too, because they're both in school, and it's school's hard. It's, you never know what to do, and so they come back and this teacher that or this that, and I said, I've got two goals for you in school, just two. One is learn something so you can interact in the world like a smart person, and the second is you're learning how to get along with other people. Like if you achieve those two things going to school, you're going to be successful. And the grades are great because it shows effort, but at the same time we can't always control that. And learning how to get along with other people is going to be one of those transferable skills that you can use anywhere.
And it's learning about, you're showcasing like the process. So I think a huge deficit in our education system is that we're so focused on the outcomes. And you were saying you didn't learn how to learn. We're missing a lot of individuals who learn differently, and we're making them feel stupid and incompetent and less than when they shouldn't. Their strengths are different, and learning to leverage our strengths like we do in coaching, right? Like, what are your strengths? How can we leverage those and minimize the things that are holding you back? It's like,
Yeah.
how can we leverage your strengths and enjoy the process? So we hear a lot about the rival fallacy. And one thing I wanted to bring up, because, as a surgeon and as somebody who left surgery, it's like when I hear you talk about surgery, you seem to really enjoy it and find it very meaningful and thrive in it. I'm like, and so I was doing surgery because I thought I would be happy and worthy when I become a surgeon, but I didn't, and there were so many things that I'm still navigating through, like what parts of it didn't I like? And most of it was that itty bitty shitty committee. Right. And I brought that with me to my next profession. So it's like, we need to understand, one, what's our core why? Like, do you want to become a surgeon because that's your intrinsic interest? Because if you don't want to become a surgeon and you do it for ulterior motives, like the status and the potential income, that's going to be short-lived. You're going to be miserable. But if you do it because your intrinsic desire is high, and a lot of times we hear in med school is because it's what you knew you really wanted to do, and there was nothing you wanted to do more because you have to accept that lifestyle that comes with surgery. So I
Yeah.
think it's just so much reflection is like, what is our why and what's truly getting in the way? Is it actually what we're doing, or is it our own internal belief system that's then shaping how we're seeing the world?
Right. And we were talking before we started recording about like what we wanted to do in life, and then picking something, thinking that you're going to get something out of it. Well, I mean, my loans are really high, so I'll pick a high paying specialty, even though I don't enjoy it. I mean, what a terrible way to live. Like basically saying, I don't care what my wants are. Externally, this seems like this might work. And of course, that's going to fail. I direct people to that why I became a surgeon all the time as the number one thing when you're feeling like crispy around the edges, or, frankly, in burnout, is to remind yourself why you did it in the first place. Because this was told to me, a lot of people have said this, that's been told to them too. When it comes to surgery, they say, try to do anything else, anything else. And if you can't do anything else, then fine, then you could do it.
Yeah.
But and what that basically says, and I'm so glad that they did that, it's not because of the malignant way of it. It basically says, just make sure you're really interested in it. And so from surgery perspective, we know because the path is long, there's a lot to it. There's a lot of, sacrifice, both personally and for the family and things like that. But essentially what that says in a slightly harsh and, misinterpreted way is to say, just pick what you want to do. Make sure it's what you want to do. And if there's something else you would rather do, then do that instead. I mean, that's essentially, like, when you phrase it differently, is a very kind way of saying, nobody cares what you do. Nobody cares that whatever you achieve or what school you went to. At the bottom of all of this is, if you are truly interested in that, you will ensure your own success, because you've already declared that as a success anyway. The arrival fallacy implies that I will get to some place and I will feel that way. So what happens is, I'm going to be a surgeon because I'm going to be knowledgeable. I'm going to be able to fix things and things like that. And it's who we become to get there. So it really is the path to get there. And we definitely have some demonstrable, kind of things that you can see, but we already knew that that's what we wanted to get to. So we had the vision to get there. So then you take the steps to do so. And that's where the arrival fallacy kind of falls short, thinking, I'm going to feel differently when I get there, forgetting that you can feel that way right now. Like, I'm still interested and curious and want to know how to do things, like, technically wise, and don't expect to know all the answers. I'm not terribly worried about that either, because how boring would that be? In fact, that's, I think, where a lot of the mid-career slump comes from, when you're like, nothing really excites me anymore. It's all the same.
Yeah, and it's never all the same, right? You can always be learning something different, and in each patient's so different, right? If we really focus on the humans, which is hard when they're asleep sometimes. But I was listening to you and Dr. Megan Mello, and she talked about kind of like knowing things before we learned it. And I'm just thinking about things that sabotaged my surgical training career. And it was specifically being in situations where you would have the attending that liked to pimp you and you didn't know it. And for me, who already had the base foundation in my brain that I don't deserve to be here, if I didn't know something, like, I remember the questions because I have all the guilt and shame I felt like I didn't know it, where I was, first time watching an implant being placed. I wasn't even placing it myself yet. I was just there to observe it. So then I, see one do one. And they laid a bone graft and they said, what are the 4 stages of bone healing? I'm like, I have no idea. And, and then just like reamed me out, or, I couldn't see the alveolar ridge, the bone which I was going to place the implant. When on the next patient there, I was going to actually place the implant, and I got reamed out because I didn't just place them. Like, well, I can't see it. I can't see. I'm not going to place it. And just the experience of feeling that negative feedback from an attending, and I didn't have the emotional intelligence to take a step back, take a breath, not make that mean something about my self-worth, because I had determined that becoming an Air Force oral surgeon was when I would develop worthiness, rather than developing worthiness and pursuing oral maxillofacial surgery in the Air Force. Like, if I was grounded in this self-worth, it would have been a lot more stable, which I find, we do such a disservice when we don't help people to learn the life lessons before they take on these really challenging careers. Because I know I saw a lot of different students who were struggling usually third year when it's the first time they're separated from their classmates and they don't know everything because, the first years of med school, you kind of given all the information you need and then tested on it. Whereas words, it's like, there's just like so much. And if you don't know
Yeah.
it, it's like you kind of have to reframe, like, I am here to learn, not to prove that I know it all already.
Well, doesn't that go just to the philosophy of pimping in the first place? For me, pimping was like a way to demonstrate knowledge. And it's also on the other side, a way to impart knowledge. So if I'm asking a question, I'm allowing them to demonstrate that they know what's going on. And if they don't know, I'm like, I just tell them, and now you'll know next time. So it's important to recognize that the ability to test is part of knowledge. So I think teaching, for one thing, so we learn, then teaching is learning twice, because now you have to learn it and then teach it.
Yeah.
And then there's another level of testing it. It's the ability to recall what you know and to challenge it. And that's where teaching is both on both sides, a different way to learn. So if you take it as a different way to learn, then you're not afraid of people asking questions. I won't know it this time, but I'll know it next time.
Yeah.
And or for me, I'm like, I just want to know what you know so I can assess where we go next. I mean, I could give two craps if you don't answer, unless I think it's really dumb. I did have someone say, like, what's the boundaries of mastectomy? And one guy said the lung. I'm like, okay, well, let me give you a minute to think about that one.
Yeah. Maybe you didn't hear my question. Let me repeat the question.
Well, sometimes people are nervous too. So you really just have to kind of meet people where they're at if you really want them to get better. So, for me, it's a little bit harder for me to even remember sometimes as a student because I didn't have those same worries. And I think probably what it was is, I was always a pretty studious person. And because I had learned to learn, I was ahead of many people in my class. For one thing, I was a little bit older and I'd already learned how to learn in a different way. So I really felt like I did have an advantage over a lot of people. So when someone asked me a question, I do remember really feeling this. And I know I talked about it in the episode is, I don't know this, but I know what I'm supposed to know. And it's okay for me not to know this. Or, not having a lot of drama in that moment. And, I've learned this now, it's even more important. If you say, I don't know, it goes to the next person, the heat magnet's on them, they've forgotten that you didn't know it. There's a lot of strategies to that.
Yeah. And it brings up the self-compassion, right? It's like having self-compassion, which I had 0% of. And, I was raised to believe that we had to beat ourselves down in order to grow thicker skin. And in somebody that was already have low self-worth, that beating myself down just cut me down. And learning from Brene Brown, I have a cup here and I always usually show it. It says, what would Brene Brown do? Because her lessons really catapulted my healing journey, gifts of imperfection and her vulnerability and not hiding with the guilt and shame, which I did for 4 years after I left surgery and felt like, oh my God, the military determined I was unfit as somebody who was an athlete in college and had created this persona of just being capable. And then to be told I was unfit and lose all my identities at one time, I was so lost. And then, you find the people who resonate with you. And Brene Brown talks about in her research, she found that the people who had the highest levels of mental toughness actually had the highest levels of self-compassion. And when she asked, like, what do you feel would help people develop the most mental toughness? We're all like grinding ourselves down and overcoming, right? And she's like, no. And, it's a surprise to her too, I think. And, how profound it is just to take a step back, because I thought, as someone who is emotionally sensitive, I thought, oh my gosh, and now I'm going to lean into self-compassion and be even more of like a little fluffy person that is going to get walked all over. And it's done the exact opposite. And I'm curious how self-compassion resonates with you and shows up in your life.
It's funny as you were talking, I had a vision of what this was. And so, how like if you have a sibling, like no one could beat up my brother. It's kind of like me, like no one could beat up me. I did that myself.
Yeah. Yeah. No, that's weird that negative self-talk has a role, right? Like that's why it often.
I mean, yeah, it's normal, right? Because
Yeah.
it's just like our negative self-talk is basically like a red flag of saying, hey, you may want to pay attention to this. Yeah, I'm not sure. You maybe want to read this a little bit, So if we take this negative said talk as like the henny penny, the sky is falling, then we're like, oh, I actually wrote an article called "Stop Resisting the Imposter," because it's essentially a voice that's in your head that's saying, I'm a little bit worried right now. So then you just ask them, what are you worried about? Like, what's the problem here? Well, I'm worried they're not gonna think I'm smart. I'm like, come on, top 1% of the world here as far as knowledge. Of course we're smart. I just don't know that, and I don't care. And we can learn that. So it's just a matter of, taking that negative self-talk as suggestions rather than indictments is a huge difference. Is, to be able to have the ability to listen to that voice, because this is what changes when we interact with other people. Is there's a difference between other people making us feel this way and us influencing them so they will treat us this way. Meaning that I want someone to treat me with respect, but if they disrespect me, I don't actually necessarily make it mean that. So what I instead saying, like, I'm feeling disrespected. So in what way do I need to ensure that I create the environment where I will be respected? And whether they do it or not, whatever, that's for my boundary to choose. But I don't really sit and dwell too much on this idea of disrespect, because if someone comes at me in a way that makes me feel a certain way, it just tells me I have not created the environment where I am to be respected. So in that particular instance, I usually kind of drop into this, certainty of I will be respected. I'm not actually worried about what you're going to do, but I'll hear you out, but there's a line to where that's not going to go. And automatically I kind of create safety for myself. And I also don't demand of them to necessarily do something. And if I do, it's very clear what that's going to be. I actually will not have you talk to me that way. And you did not tell me the truth last time, and so I'm having difficulty deciding what I'm going to do for you. And it's that degree of certainty that we feel and the way we convey it, because like you can say whatever you want, I don't feel any differently about me. Then all of a sudden you sort of instill doubt in their mind of like, oh well, she doesn't seem to be bothered, maybe it's me. I'm like, yeah, it's you.
I love this. It resonates so much. So 2 years ago, I was working and I didn't get paid. And I was like, why do people find that they could just walk all over me and not pay me? And then when I would try to advocate for myself, I mean, I was severely undernourished from an eating disorder and didn't think I was worthy of food, right? So I was like, oh, okay, well, I don't think I'm worthy. I'm showing up like I'm not worthy. I was very much not the vocal advocate. I was clearly not on social media with, I didn't look well. I was not presenting myself on social media. And I had left surgery. And so it was 4 years after that. And so I still carried the guilt and shame of feeling like a failure. And I didn't have a self-worth that was separate, or an identity separate than my military surgeon days. So I didn't take that pause to like actually reestablish who I am. And then I found a quote that you reminded me of by Danielle LaPorte, who's an author. She says, the world reflects back at you how much you value yourself. And I was like,
Oh yeah.
ooh, punch in the gut, right? Because people can't make us feel a certain way. You just showed fierce advocacy for self, including boundaries and self-compassion, right? Kristen Neff says that that's the fierce self-compassion. And leaning into her work, then I put on like new glasses. Like I started treating myself well. And after years of not, then I felt that tension. If someone's disrespecting me, I felt it. Whereas before I wouldn't, because that's what I thought I deserved. So I was like, I wouldn't say comfortable, but it felt familiar in what I quote unquote deserved. And then when you develop self-compassion and respect for self, and you show up like you just said, is I am not going to accept that treatment from self or others. The people who were benefiting off of our lack of boundaries, or benefiting off the fact that we didn't value ourselves, they will create friction. Like they will get real riled up. And you have to stand your truth and just expect that some people are going to be uncomfortable when you start to use your voice, start to demand respect, and just show up the way that you wish to be treated.
Completely agree. And I think when we have this feeling that someone brings out in us, I think that you said it best too, when we talk about like, that's actually a mirror. And the work that I do when I coach people is, we work through the thought model, this idea like a neutral circumstance, at words, actions, whatever. Everyone agrees on this, but not everyone agrees on the thought or the emotion that leads to it. But that's where our actions come from, and that's how we get our results. So when I work with someone and someone sets them off, the most important thing is to get to, it's like, what am I thinking? And not just what am I thinking about them. It's like, we have like a million thoughts that come up about different things, but where is the thought that is specifically mine to address? So like, if we think of all the thoughts that strip that other person, and now it's just a mirror of what we think about ourselves, then that's where the real work is. Because if someone comes up to me and says, like, you don't know what you're doing, I'm like, yeah, I do. Whatever. I
Mhm.
mean, it was like my neighbor. I love my neighbor, but my neighbor comes up. He's like, you don't know what you're doing as far as surgery goes. It's like, well, you're not a surgeon. I wouldn't think twice about this. And so that doesn't bother me at all. That's just someone who's saying words. Now,
Yeah.
those same words came from like my program director or my partner. Those words were hurt because there is a degree to that I believe. And so it is that belief about myself is where my work is, not them. They've simply pointed out by showing a mirror to me what I'm thinking about myself. And the work that I have is an internal work of belief and not a convincing energy of someone else. Because if I do the internal work and I'm like, am I a good surgeon? Oh, yeah, I am. And so
Mhm.
that certainty, like, now you can move on. So there's like, they can not be present or be present, and we can do the work. And this is so important when we have a difficult partner or a difficult job. Is, I talk about people having an exit interview with that person, but they don't have to be with that person. A lot of times, we just need to resolve our thoughts about the people and the job, and it's usually our thoughts about ourselves within that job, or in interacting with that person. So I liked your comparison of like them actually being mirrors, which eliminates them from the equation, which I think is really useful.
And it puts you back into the driver's seat. One thing, we develop in the system, people that have stayed in the systems that aren't working for them for a really long time can develop learned helplessness. It gives other
Mhm.
people control and agency over your life. But one thing about coaching and what you just presented was that it puts you back in the driver's seat of your life. So you're determining, well, what's in my control? Oh, it's the lesson that they just showed me is where I need to do the work. Like for me, when I left surgery and then, didn't know who the hell I was outside of it, it's like, oh, well, I need to shape my identity that's not reliant on these external factors and achievements so that it's stable. And of course, back to Kristen Neff's book, she talks about the difference between having self-worth grounded in self-esteem, which is more achievement based, or self-compassion, which can be stable. I'm like, oh yeah, I was very self-esteem driven, which is, highs, lows, highs, lows, high lows. And you're like, oh my God, you're all over the place. Or just grounding yourself and I have worth no matter what the heck I'm doing. So then you just have a little bit more stability in your sense of self. But yeah, I like the idea of what you captured here is that, we can't change people. Often, we talk a lot about in our, the people that we know well, you have brought up situations of gaslighting. You hear a lot these days about people with working around people that more have the narcissistic tendencies. I won't say so far as like the narcissistic personality disorder, because that I guess is less common. But there's a lot of traits, right, in people that are in these positions of quote unquote leadership, and in those situations, we want to try to change them to improve our circumstance, but we can't change the people, right? And we can create the environment that you showcased when you said, I'm going to keep myself safe, right? Like, how can I keep myself safe? How can I identify what's in my control, what I'm going to tolerate, what I'm not? And then as you see, okay, this is as much as I can control, that can inform like, am I going to stay here or am I going to leave? So it's just so important to focus on what's really within our own agency.
Well, the idea of the gaslighting is like you're in a situation where someone typically of authority tells you that whatever you feel is wrong is actually your fault. So if you're able to like get in a position of saying, I mean, I don't know, is it? And if you answer no, it's the ability to be able to answer for ourselves, like, why am I feeling discomfort? And sometimes it's us, sometimes it's them, whatever. It's almost beside the point. It's like, what is really the problem? And once we identify what the problem is and not the personalization of it too, then we bring it back to what we can do. Now that's obviously glossing over some pretty substantial environments that people find themselves in. But, I think that really the idea that we have the tendency to potentially be gaslit is recognizing when someone else is telling us it's us, that we can now stop and say, I don't know, is it? Dropping into this inquisitive part of this. And I think that's so important to be able to do so, because we should be able to look at ourselves and say, well, sometimes it is us. And especially if it's a bad environment, when we adapt to a bad environment by sometimes being the worst version of ourselves, So when we decide to exit because we've kind of reached that max, what we have to do is deal with in that moment, we are not our best self. We are often our worst self. So if you now take away that person again and that mirrors up, what that mirror shows us is we're now looking at ourselves in the that we're not our best self. So if we're not our best self, is can we just realize now I can look at the context and say, of course I would be my worst self. This was terrible. This was not what I wanted. This is how this worked. And I think the only way to get out of some of these situations is with self-compassion of saying that, yes, actually, it was me. I think we can all thank Taylor Swift for saying, yeah, it's me. I'm the problem. It's
Yeah.
me.
Yes. And having some laughter, right? Because when we allow ourselves to kind of chuckle and give ourselves some comic relief, it can help. And no, for me, snap you out of that downward spiral of like, oh yeah, it was me and I'm worthless and blah, blah, blah. It's like, yeah, it was me. It was me this time. I'm going to own it.
Yeah.
Yeah. And
Well,
validate your reality.
yeah, and let's look at when we're in a bad situation. What typically happens? So someone acts some way. Typically, we're mind reading, and then we have our own thoughts about this. And they're mind reading us. We're mind reading them. We're interacting in ways we don't understand each other. Things go apart. And what's the first thing we do? Bring a third party into it. And the third party's like, hell, if I know. And so then they start saying, and a third party is never going to be one way or another. And I think that's really important. Whenever a third party comes in, they're always going to want to have some element of what's going on both sides. So whenever you bring a third party in, they typically don't resolve it right then. They will bring up more things. So now you're mind reading a second person.
Yeah.
So and then they have to kind of make some judgments, and they're not even part of it. So what happens when we're in these really terrible environments that we haven't resolved at the lowest level, we bring more and more people into it, which brings more and more levels of misunderstandings. And then, again, we're faced with not just feeling like we haven't quite performed as well. We now have a second person, pointing out some of the things. Some are true, some are not, but it just adds a lot of complexity to it too. So I think preparing people for these interactions being a lot more challenging than we're expecting them to be, because we expect someone to, see our side, and they don't always. And I mean, that's the nature of an intermediary.
It reminds me of, when I was feeling like I wasn't worthy and I felt like I kept putting myself into situations where people would constantly tell me like anything I did wasn't enough, right? It was like the personality that you work with, they just create a situation which then reinforces your feelings of not enoughness. I started documenting like what I did. And then I had a tangible resource that can be like, oh, wait, I am enough. I've done all of these things. Like, here are the goals of my current role. Here are all the things I've done. And that's not only great for your own validation, but also if you get into trouble, right, with your job and they're like, well, they're not doing enough. And you're like, well, here's the reality. Because I know in a lot of circumstances, then that's where the gaslighting comes in, is that people are creating unstable situations that then exacerbate somebody's feelings of not enoughness. And if they're vulnerable to that, they need to have some way that they can trust themselves and ground themselves in their current reality, which I find is document what you're doing.
Yeah. I mean, there's like so many to this. Like dealing with a difficult environment is like a whole animal in itself. I mean, I have an entire 3-month coaching program talking about dealing with a difficult colleague, just one of them. So
Yeah, I went to one of your group sessions on that one. It was a very invigorating discussion, and I highly recommend anyone that can work with you on that to join in.
well, typically, what you find is that there's so much more we can do than we tell ourselves. And, the things that we want other people to do for us, we can often do for ourselves. And then we decide if we stay in that environment or not, because there's no easy answer to all of this, but there is a pretty straightforward process to go about that. But we have to be able to, there's just a lot to it, but it's all doable. And these are a lot of things that really change a lot of things. I mean, I think probably one of the most beneficial things that I had recently was a difficult partner. I mean, I learned the most. This is the curriculum of your life that you didn't sign up for.
Yeah.
This is like where your greatest growth opportunities are. These periods of discomfort, these things that really, are really big and emotional at the time, is because there's something that you need to learn out of it. And you can, with some faith in yourself, knowing that you're going to be a better person through this. I mean, I can enter and exit more difficult rooms easier now because I don't really make them mean anything
Yep.
anymore.
Yep.
So then you actually seek them out. You're like, oh, is that how we get better? Let's go.
Yeah, I relate to that a lot. There's a book called Humble Inquiry, and it's,
Mhm,
our coaching journeys, they teach us a lot about having a mindset of curiosity rather than judging and like, oh, so man, I'm like, oh, curious why that person does that. I wonder why they think that. And it kind of snaps, like for me, that puts this space and reduces judgment on self and others. Like, oh, I'm just
mhm.
so curious. And you can kind of get a chuckle about it too. Like, oh, I'm really curious why they behave like that. Isn't that interesting?
Yeah. It's like, I wonder how this is going to go. Let's go. I'm in. I actually had a friend of mine. It's so funny how people reflect back on you what they see in you because, sometimes it's a bit of surprise. So I was talking to a friend of mine. She said, I saw a shirt that reminded me of you. And I was like, really? What did it say? And she said, that sounds like a terrible idea. Let's go.
Oh my gosh, that's awesome. Oh, I love that. And in your book, you talk about kind of forfeiting or letting go of wanting, having that part of your experience where you showed up as that hard ass surgeon. A lot of times
Oh,
we have
yeah.
that surgeon stereotype. And I was told I was too nice, and then I was like, "Oh, you should stay in surgery. We need more nice people." And I'm like, "That's why I can't stay in surgery." But but you are so nice, and you've kind of, it reminded me when you were just saying, like, even those difficult conversations, like, how do I want to show up? Like, here's how people tend to typically view a surgeon showing up. Here's how I prefer to show up. So I'm going to show up that way. Can you share a little bit more about that part of your life where you went from hard ass back to kind of your true self?
Oh, yeah. I mean, I think that we all had to try that suit on for size, because that's what society offers us. If you say like a surgeon is typically a very nice, considerate woman, she gets the best results, by the way, documented. But
Yep.
so like we're told this, we're suggested this, and so we behave in ways that are suggested. So a lot of the problems that are wrong with the culture is simply a thought that has been perpetuated across generations. So to be able to change the perception of that, you first have to decide that it's just something I've been offered. I don't actually have to keep it. So I think a lot of us tried to be the hard ass and tried to do the things, like get to the point where you like, make people cry because we're so demanding and stuff. And then you realize, I mean, at some point, just say, this is not who I am. And not exactly sure when that evolved, but I started realizing I could be myself. And when I was more of myself, I was actually able to excel further. I really tapped into who I was and I didn't have to be anybody else. It was just refining myself and being authentic. And so I still have someone come in and say, well, I didn't expect you to be a guy. I'm like, yeah. I mean, I don't make it mean anything
Yeah.
either. Of course, they're offered the same thoughts that we are too.
Yeah.
And I get this all the time. It's like, well, you're so nice. And I'm like, why wouldn't I be? What was it you were expecting? But it doesn't make me less certain. It doesn't make me less knowledgeable. And I think that my certainty about myself, like channeling the certainty about myself, gives it a lot more grounding than yelling ever would. For me to say like, no, I'm good right now, how it is, and I'm going to be here for you, no problem. You can call me, and if I'm on, I will, and if not, I'm okay with that too. I'll have a plan. So you can be nice and you can have boundaries and you can just be yourself. And what I have found is people are more reassured by that because they're not trying to respond to something that's not congruent with who I am. And Kasia Urbaniak in The Woman's Guide to Power talks about that is in the way of what we're taught. And she does it differently than being a surgeon is, because a surgeon is like, this is what a surgeon is, hard ass. Where she talks about, especially women in society, we're given like the good girl persona. And good girl persona is like, we do everything, all the things, we never complain. But then she's like, independent woman is good girl 2.0. So now we're like, I don't need you. I don't need anybody. I'm going to do all myself, which means we're limited by what we're able to do. So the thing is that if we try on whatever persona that we're offered, the good girl, the independent girl, the hard ass surgeon, if this is not true and unique to who we are, people are going to be interacting with a false version of ourselves.
Yeah.
And that's when we start running into problems. So for me being a hard ass, I just wasn't getting the results I wanted. So then I don't know, whenever I started being myself and I realized, gosh, this is so much easier.
Yeah, Martha Beck talks about the essential self, which is our true like our true nature, and the social self. And we are, in order to be in the world, we have to have a social self that interacts with society. But oftentimes we can abandon our essential self and lean too far into the social self, and then you feel you're living out of integrity, so out of your authentic nature. That I remember in residency when I had people that had kind of that brash, like, you're on a step back, you don't feel psychologically safe. And you're like, if you can look at the lens, like that's the persona that they had to create for themselves at that moment, not make
Yeah.
it mean anything. Like I kind of wish I want to go back into the military and back into surgery to see if I could do it better, but more for the challenge than the actual, like, because I really want to do that. I'm like, man, I developed so many different life skills since then. Like those comments wouldn't have made me feel the way, like, obviously we know, as we just talked about, that they didn't make me feel a certain way, but they wouldn't bring up the same things. They'll be like, well, isn't that interesting that we had one resident that said during match period, I don't want any females to match here next to me, and I don't want to work with any women. I'm like, well, that's her problem, right? Like that's totally her problem, and she's great, we're friends now. But I was like, at the time, it was like, well, I felt so alone at that point because I didn't feel like I belonged there, that it just heightened my sense of feeling alone and that sense of non-belonging. The other
I
thing,
think you nailed it. That thought of like, this doesn't feel like my problem. This feels
yeah,
like your.
yeah, I totally know that now, right? And even just the attending it was just not, didn't create a psychologically safe space. What that taught me is like, I value people who create psychologically safe spaces. I want people to feel psychologically safe. And I went from like, you had to know it all, right? Like you are the person that knows it all. And I was like, oh, it was making me show up in ways that I just didn't like, right? Like you have to know it. You have to show that you know it. So you're inserting your thoughts like places that maybe you don't have to. I'm like, I can just let that conversation go. Like, is it worth it? Or, you are more open-minded if you're curious to other people's interests and other people's perspectives on things. And I don't have to prove to anyone that I have all this knowledge in the world. And it's actually kind of annoying when, I'm like, oh man, my past self, if I did that now, I'd be so annoyed with myself. And to let that go, because I'm like, I don't need to be the person who knows it all.
It's funny. I'm laughing about when you mentioned the social persona. I was like, I have to say though, I sometimes benefit from that persona, and it wasn't so much the surgeon, although I use that sometimes too. I say sometimes you have to pull out the card, right? Yeah, I'm the surgeon, and I tell people too, like if I really am struggling with someone, I was like, I got to pull out the lieutenant colonel card. Colonel Vertrees is coming in now.
Yeah.
It's so funny how you can put these little suits on for size and really suggest that to yourself. So it really depends on like, how am I going to portray myself to influence the situation in a way still, unique and genuine to myself too. But that's the social persona that you're talking about.
Yeah.
We can still use them to our advantage too.
Yeah, I even do that to motivate myself, right? I used to race marathons, and like I have a lot of like internal beliefs about myself when it comes to my athleticism compared to how I was back in like 2009, which is a long while ago. But when I think about, the military, when I got discharged, I was so deflated, and like I just kind of disconnected to my physical self for a while. And like, but I still want to show up the way that I showed up when I was training, because I felt that internal identity of I am an Air Force officer, right? And you show up that way and you're just confident. So what we learn in those moments of why did I want to be that? So even the example of a surgeon, well, I wanted to show up confidently. I wanted to show up in a way that was respectful of myself. I wanted to show up capable. Well, those are still my values, right? So what it points to are our values. Because when I was thinking about listening to why everyone went into surgery and it related to mine, and I was like, oh man, so what happens when we decide that we need to leave surgery? Either it's we retired, we did a career pivot, or for me, it's like, I don't think I can stay mentally well in this residency. What I hadn't offered myself when I transitioned was, how else can I achieve those same goals? That sense of self-worth that I was seeking, that sense of being a strong, capable person, the sense of being a badass, right? Okay, well, I wanted to become a surgeon so I could be a badass. Okay, well, what other ways can I be a badass? And what I learned also is when we're so tired, when we are feeling hopeless, when we are having thoughts of taking our own life, like your brain can't offer you a lot of opinions. You're in survival mode. So it's so necessary to take yourself away from the environment, give yourself permission to rest, because then your mind can open up all these different ideas and opportunities for you to explore. And I think, if people are listening to this and are like, yeah, it's great. You can coach yourself into staying places. I coached myself into continuing to go back into surgical residency because I was afraid to pivot. But say you need to take a pause and you need to reevaluate, and you also have this belief that you had to do a certain thing to achieve something. Well, how else could you achieve the same goals that you're striving for?
Yeah, completely. And you don't have to be a surgeon to have that persona. I mean, you could be a badass flipping, burgers. You could be a badass doing omelets. Like, these people that just have something about them,
Yeah.
and recognizing that we still have that about us, but we could still follow, knowing our values, deciding what we want to do out of interest. I mean, there's nothing wrong with any job in the world, because at its core, it's just we're all just living, making a living, trying to be happy in the world, trying to be satisfied, and trying to be true to who we are.
I think the badass comes from somebody that's so comfortable in their own skin. They're like
Totally.
untouchable, right? Like that's what
Yeah.
makes the badass.
Yeah, exactly. Completely agree. And
And
you don't have to do something you don't want to do just to get this, because you're not going to get it anyway. That is the arrival fallacy.
yeah,
You're not going to feel like a badass by picking something just because you think it will make you that way.
yeah. And you also talked about in that episode, it was 2 on your podcast, like our goals and our values kind of shift throughout our lifetime, right? It's like different things, like the reason why you became a surgeon at one point in your life may not be true to what you are today. Can you share a little bit more about that discussion?
Yeah, I mean, we're always shifting and moving. I remember, we got married, and I was like, I'm not want kids. That's just not for me. And then all of a sudden, like one day, I'm like, oh no, today I do. And then, one day I was like, I want to do surgeon. I want to be a surgeon. I want to do all the things as a surgeon. And we did our trauma rotation. I was like, this is great. But then I also kind of knew this isn't the life that I want. So, and even now, I mean, I have the exact practice that I want. And I do see at some point, it's evolving to where I'm doing a little bit different than I thought that I was going to do. Now there's some cases that I'm happy to kind of give away. I'm not trying to strive to do all the things anymore. And I think that our careers definitely ebb and flow. At some point, if we do not pick the career as our identity, if we are really just gauging our identity by our how we interact in the world, and not necessarily from our job, when we're not attached to our job, sometimes interests pull us. And it was actually Wendy Schofer, I know you know her,
Yeah,
where
love her.
she was talking about like medicine as a calling. I was like, it just occurred to me that medicine as a calling is like a telephone, and we keep answering the call until one day we're like, I don't think I'm gonna answer the call. I think I'd like a different call.
Yeah.
So
Yeah.
there's a lot to that too, is that if we're really listening to our true and unique self, our lives evolve, and we don't have to judge the evolution of it. We do change. And Arthur Brooks, From Strength to Strength, talks about this, about how, we go from this achievement lifestyle to more like about us, to shifting a lot of times into purpose driven. Now we're more reflective.
Mhm.
It's a different goal in life. We're not achieving all the things anymore. Now we're shifting our purpose. So I think that our purpose are continually shifting. And I think that's a natural life cycle of a human, because if we achieve forever, we know those people who achieve, and that's all that they do. They'll never let anything go. They can't. But for those people who are not so invested in that job as an identity, will get to a point of saying, this is great, and I'm satisfied, and I'd like to do something different now. And that's when you jump to that second curve and deciding, I think I'm going to try something different now.
Yeah, that pivot point came for me. I mentioned to you a little bit earlier, before I think we started recording, is, I have very profound memories of my experience in surgery, and flying myself to a hospital for treatment that I thought was going to save my life after, I was compromised from my eating disorder. And it was like that slow death from a point of unworthiness, because all those thought spirals had gotten to that point and I was so numb and dissociated. But I do remember sitting there and I was so alone. And I was reflecting back. I'm like, wow, I sacrificed so much to get here. And what I sacrificed was actually what matters to me most, like the deep connections with people.
Mm-hmm.
And getting to know people and spending time. And you do this well as a surgeon. It boggles my mind because I'm like, man, okay, so she's kind of proving that she can do that and surgery. So that's awesome. But, but I was like, wow. But, and I was like, all of the things that when we're achievement driven, like I thought that hanging out with friends was going to get in the way of my ability to achieve the high levels of which I wanted to achieve. And I always thought that hard work was associated with self-worth. Like the hardest you work, the more worthy you were. So I just pushed away so many people and didn't work enough on my self-worth. So like what was really catastrophic for me and why, didn't have the energy for surgery is like, well, you're sleep deprived, you're not eating and you're not talking to anybody and you don't know if you want to do this. And like, well, of course I was going to feel the way that I did. But it was like really sitting and allowing myself to accept, like, if this was the end of my life, what would I regret? And it seemed to me to be clear that the values that I had associated with some academic achievement weren't the fulfillment that I was seeking, because I was always very much like, what's the meaning and purpose of life? And how do I explore that and lean into that now? But it's really hard to start unlearning. And that took several years later, because as I mentioned to you, like the hospital couldn't keep me and I flew back and threw myself right into working because that was another coping strategy I have. And it wasn't the right time of my life to allow myself to sit and process. Like I wasn't fully capable. I didn't have the nourishment. I wasn't feeling the full spectrum of emotions. So allowing myself, like I did the best I could at that time, but I can't forget what I learned from that experience. So now if it's like I work in academia, well, your worth is based on your publications. I'm like, but is it really? But it's not. Like, it's like it's hard for me to share those values because because I know what it feels like to not know if you're going to survive the next day. And all of us should know that because that's our truth. But unless you've faced a serious illness, you may not. And I work with cancer patients, and there's this meaning-centered psychotherapy that's like, it's all about that. It's like helping people to redefine what matters to them, because sometimes when they're facing serious illness, they get this existential crisis, like what I was doing is not in alignment with what I wish to do going forward. And how to allow ourselves to unlearn and not have it completely shatter our identity, because I felt the risk for me and many of the people that are in medicine or even in the world today. It's like, is my life worth living? And we're at risk of taking our own lives. And I felt that impact. And as I look back, it's like, well, I had all these risk factors too, right? Like was a dentist, was in surgery, wasn't sleeping, was in medicine, and anorexia is the highest mortality rate of all psychiatric disorders. And like, well, I learned a lot about suicide. And so how am I going to use that knowledge to help support others? So I really appreciated how you shared how all of your life lessons culminate into what you're doing now. Cause I'm like, yeah, it's like, I wish I didn't have to hit those rock bottoms to be so passionate about speaking out about this. But when people are like, you're so brave, I'm like, no, it's like, you just have this deep advocacy within yourself because you know that the risk for some people will be their life. And if it's not literally their life, it's losing themselves and then, living out their journey without ever stopping to get to know themselves and what they truly want.
Yes, and you know this already because I know that you and Dina talked about this with fear, self-compassion, of the three things of mindfulness, talking kindly to yourself, but the common humanity. And I think that's where really when we stop judging ourselves, and this is what happens to me when I have a bad interaction, and a little bit of a humorous note, like if I have a bad interaction with a colleague, I had this one hospitalist, it was just, it was ridiculous. I won't even belabor details, but I remember thinking, bring it on, buddy. This is about to be a viral post because someone needs to hear about this because we're going to work on it. So, I mean, it's so funny because like then every pain has a purpose now. So like looking back, like everything that I went through that was a struggle, I have turned into a lesson. And I created enough of those painful lessons in my life to write a whole dang book, and I probably got more. So if you think about it, these are the whole purpose of the things that we experience is to process them, because otherwise, what is the point? What is the point of suffering? The point of suffering is not to make us suffer. The point of us suffering is for us to feel deeply and strongly and not perfectly and create something out of it. And that's really, I think, what we should think about when it comes to suffering. Like it's what we're going to do with the suffering that makes a difference. The human existence is suffering. So then that comes to our personal choice of what we decide to do with that.
And it's hard in medicine too, because when people talk to me about me sharing my story, there's fear that if they were to speak out, they could lose their career. And I lost my career, my military career. Surgery, I elected to leave. I think it was in the best interest at the time. But when I lost my military career, that was devastating for me. But as I reflect back now, it's like, wow, we're really putting people in positions where, just like me, they think that they would rather risk their lives than risk their career. Or for me, it was like, I would rather risk my life and stay in this surgery than risk the guilt and shame of being a quitter. Like, there's very profound thoughts that you feel are real at the time. And it's that sharing, just like you said, common humanity. What was the turning point for me in carrying that guilt and shame alone was writing. I wrote everything I write in Kevin and D is like all my biggest insecurities. I'm like, well, if they all knew this, I would be free. So, you just keep writing anything that you're hiding in the closet. You're like, if you just air it out, then you'll realize you're not alone and it's not as bad as you think it's going to be. And if other people are judging you, just like we talked about earlier, it's usually a reflection of what they have going on inside. And you just like, whatever, but it was such a relief. And it's still, it's still a process in working through and allowing yourself to sit through all the discomfort of every single type of emotion that arises.
So this is going to be an unexpected inspiration, but from the what was it? Game of Thrones, Tyrion Lannister. Do you remember him?
No, I've never ever seen the Game of Thrones, but I'll believe you.
Yeah. So Tyrion Lannister was a dwarf, and he was one of the he was a bastard, which was apparently obviously a big deal because it's sort of like medieval-ish kind of thing. Mm-hmm. So he had a statement in there, and he said he was talking to someone else, and he said, "Never forget that you're a bastard, because the world won't. But if you use it as an armor to protect you, no one can hurt you." Which is essentially saying that, if you look at the elephant in the room and then you decide, well, I'm going to wear an elephant skin, then that's it. I mean, people can't hurt you. They hurt you when we try to hide. So that, going into Brene Brown's work on vulnerability, that is our greatest strength. Caring is our greatest strength. So once we realize that vulnerability and caring are our greatest strengths, then, that is where the badass surgeon persona comes from, why not do caring and vulnerable? Because now, that's tapping into the greatest strength that we have. I won't be satisfied with just yelling at people. I want stronger. And that's caring and vulnerability.
Yeah. And I always think about the people who can show up. There's a surgeon that works where I work now, and he's super nice, like super duper nice. And I was intimidated to meet him because I was like, I have no idea what to expect from a head and neck cancer surgeon that works at a very well-known institution, right? You just think the worst, and he's so appreciative, so nice, such a joy to work with. I'm like, show up the way that you want to be treated. Show up, like, for people who aren't showing up for you the way that you wish they were showing up for you, show up for them that way. Like, for people who treat me bad, I'm like, I'm going to show up for them with so much compassion, because showing up with them being angry inside is only hurting me and creating increased reactivity during our conversations. So I'm going to show up with compassion. It will be so confusing for them. I'm going to show up using humble inquiries. It's going to just kind of disperse the negative energy that's coming at me and create energetic boundaries. Like, whatever is coming up for you is, it's going to stay over there, and I'm just going to create the space and breathe in it and give myself self-compassion. So yeah, I think I really appreciate the mentorship and the leadership that you demonstrate through your own actions and the way that you present yourself.
Likewise.
Well, thanks.
So I mean, you wouldn't be able to do all that you did without the experiences that you had before. So if you think about that, you're like, oh, of course, makes sense.
Yeah. And I know I've kept you here for a really long time, so I'm going to be mindful of that. We have so many lessons, but are there any lasting lessons, or one strong lesson you'd like to leave the audience with here today?
Yeah, I think the biggest thing is really just know who you authentically are. And you don't have to know right away, but really just strive to find who you authentically are and come from that place and not from any other. Is knowing that everyone is going to offer you some suggestions, but knowing that you have the choice to decide. Life is so much easier and so much rewarding. And then you really tap into what you specifically have to offer the world. And that's really what people are looking for.
I love it. It really fits my channel theme of a life true to you. So great. So Amy, where can they find you?
So bosssurgery.com is probably the easiest place to find me, because you'll find links to the book, the podcast, and my coaching program.
That's awesome. Can you tell us a little bit more about your coaching program and who who would be the
Sure.
ideal person to come into your coaching program?
Yeah, that's a great question. So I have got a one-on-one programs, which anyone could come to. It's 10 sessions typically because I find, I used to do 6, but 6 is about the time when you start having breakthroughs. And I was like, I can't leave you like that. So anyway, that's usually where I decided over after doing this for a few years, that was a nice sweet spot in getting enough results and then, really getting what we want. So 10 sessions for anyone. Now, my coaching program is a group, and right now it's only for female surgeons. What I wanted to do was really work with in that room for a bit before I expanded to others. And it's 3 months at a time, but it's an entire year. And it goes through 3 months of the difficult partner or colleague, 3 months of dealing with complications called is complicated, 3 months of negotiation, which your most formidable competitor is not a surprise. It is yourself. Negotiating with yourself is a lot of things we talk about. And then 3 months of stop hating clinic, and which that starts on Wednesday. So it's all about what I thought was a well-rounded, talking about all the things that we were not taught in residency. And we have a lot of practical things on there, getting paid, delegating, things like that. But really a lot of it is mindset and tapping into that true and unique person that you are, and showing up as your authentic self and finding your strengths and leading with your strengths. Those are majority of threads that are passed through within all of that. And a lot of my coaching has influenced the work that's in the book too. So even without that coaching, this is certainly a great place to start. But feel free to reach out to me, because if there is enough interest beyond female surgeons, I have that in the back of my mind at some point. This on the 3-year plan for sure.
Being around, I can appreciate why it's important to have a safe space for female surgeons to come together. It's really
Yeah.
important to have that community.
And it's important to recognize there's no leaving surgery. There is, I followed this path that it didn't work. And that goes into, I'm following my unique pathway. Somewhere in society, this was suggested that surgery is my path, and it wasn't. And, I don't belabor any of that too, because no one should be on a path when it's loud and clear they should not be on there just because of what they think someone who honestly doesn't think anything about it will think about him.
Yeah, it's so important. So we could talk for so long. I'm sure
Here
might
we
have
could.
a few more conversations under our belt, and I'll be looking forward to your book number 2 coming out. So I'll
So
make sure to share all of your links down below. Amy, thank you so much for joining me today.
thanks, Jillian. Such an honor. I really, really appreciate it.
And for everyone that's listening, that's watching, make sure you share your questions, your insights, and your reflections down below. We would love to hear from you. So thanks for being here.